Hey guys, it's Dave. Today we're going to talk about tranexamic acid and how it can help with patients with either melasma, which is splotches on your skin of different pigmentation, and hyperpigmentation. Tranexamic acid actually comes in a tablet form, but what we're talking about today is the topical form, which they do make commercially. You can also get it compounded as well. It is derived from lysine. So if you wanted to try something cheap just to see if it works, you may take some lysine supplements. They come over the counter. Generally, though, for the most part, they have not had very many studies regarding that. Lysine does help with things like cold sores to prevent fever blisters, things like that. But there have not been as many studies with the over-the-counter oral supplementations of lysine. It's not going to hurt you, it may help you. Lysine actually alters the way that cells produce melanin. And the tranexamic acid form is a stronger and fully produced form of the lysine that helps more in this way. That's why there's not as many studies of it just as lysine, but tranexamic acid has had more studies regarding it. It strengthens the skin as well, and it can decrease rosacea. So if you're one of those patients that may not have melasma, you don't have hyperpigmentation, but you have rosacea, which is where your skin, especially in the face, around the ears and the cheeks, gets really bright red, not due to a sunburn, not due to irritation, but it is rosacea. And there has been a small study out that does say that it can help with that to reduce the redness. It does brighten the skin, give you more of a healthy glow, and a 2019 study actually showed a 27% decrease in melasma, which is those splotches of hyperpigmentation on the skin, by 27%. So that's pretty good numbers as far as that goes. A 2022 study just put out that it can also help to lessen the inflammatory response post-acne. So when you get the redness from the acne, especially if you're messing around with them and you get the pustules and you get the big welt spots basically around your body, this study said that it can help lessen that. So that would be something to look at too, especially if you have acne over a large portion of your body. It can help with sunspots as well, which we really see mainly as you're getting older. You see those brown light-colored spots show up that are caused due to the sun. Tranexamic acid can help with those. The good news is, generally, it is a safe product to use. People with sensitive skin, however, can see irritation, which is why it's best, instead of covering a large area, especially your face, but just do a test patch. So maybe the size of a quarter. Do a test patch with that. And it would be best maybe if you had areas on the face and maybe on your back or your chest, do your back of your chest first before you put it on your face in case there is irritation. Some other things you can see is dryness, flaking. Sometimes if it gets severe, you can see hives with severe itching. If that happens, stop taking using the product right away. Generally, you're just going to be one of those people that have a reaction to it. You can see some skin discoloration, not the kind that you're trying to achieve. If that happens as well, stop using the product. You can use it any time during the day, but the evening is the best time to use it, especially after cleansing your skin with a good skin cleanser and before you moisturize it. Apply it, give it about 10 to 15 minutes so it really gets a chance to absorb and soak in before you apply the moisturizer. It generally will take at least 2 weeks before you see any results with it, and up to a month. After a month, if you're not seeing results, you may be one of those people that it just doesn't work for. In the strengths, 5% has shown to give the best results. However, with those results, it also causes more irritation because of the higher concentration in it. So you may want to try a lower concentration, especially if you have sensitive skin.